This 76-year-old woman walks 3 miles every single day. She's religious about it, never misses a day. Then one afternoon, she trips on a sidewalk crack, falls, and fractures her hip. 6 months later, she's lost 40% of her independence. Her doctor asks, "Have you been doing any strength training?" She looks confused. "I walk every day. Isn't that enough?" Here's what orthopedic surgeons know that most people over 75 don't. Walking is wonderful, but it won't save you from the fall that changes everything. After 75, your bones become fragile, your muscles waste away at an accelerating rate, and your balance deteriorates in ways that walking alone cannot prevent. The statistics are brutal. 1 in 3 adults over 75 who fracture a hip will die within a year. Not from the fracture itself, but from the cascade of complications that follow immobility. Today, I'm going to show you exactly what orthopedic surgeons recommend you do after 75 to maintain your independence, prevent devastating falls, and keep your bones strong enough to survive the stumbles that inevitably happen. This information could add years to your life, and life to your years. Why walking alone fails after 75. Walking is excellent exercise. It improves cardiovascular health, maintains basic mobility, supports mental health, and gets you outside. But walking has critical limitations that become dangerous after 75. First, walking doesn't build bone density. It maintains it at best, and often not even that. Bone responds to stress by becoming stronger, but the stress has to be significant. Walking provides minimal impact force compared to what your bones actually need. After 75, you're losing approximately 1% of your bone density per year, sometimes more. Walking cannot stop this loss. Studies show that walkers over 75 have no better bone density than sedentary people of the same age. The force just isn't enough. Second, walking doesn't build meaningful muscle mass. After age 50, you lose about 1 to 2% of your muscle mass per year, a process called sarcopenia. After 75, this accelerates to 2 to 3% per year. Walking uses your muscles, but it doesn't challenge them enough to trigger new growth. Your legs move, but they are not working hard enough to send the signal to your body that says, "We need to keep this muscle." You need resistance that pushes your muscles close to their limit to maintain or build strength. Third, walking doesn't challenge your balance in the ways you actually need. When you walk on a smooth, flat surface, you're practicing one very specific balance skill. But most falls don't happen during normal walking. They happen when you step off a curb wrong, reach for something while standing on one leg, catch yourself from stumbling, or recover from an unexpected push or bump. These require lateral stability, reactive balance, single leg strength, and rapid muscle recruitment that walking never trains. Fourth, walking doesn't prevent the postural changes that increase fall risk. As we age, we tend to develop forward head posture, rounded shoulders, and a forward lean. Walking can actually reinforce these patterns, especially if you're looking down at the ground to avoid tripping. These postural changes shift your center of gravity forward, making you unstable and more likely to fall face first. The result? You can walk religiously every day and still have weak bones, diminishing muscles, poor balance, and bad posture that sets you up for a catastrophic fall. This isn't a criticism of walking. It's a recognition that after 75, walking alone is insufficient for the specific challenges your body faces. The 4 pillars of movement after 75. Orthopedic surgeons who specialize in treating fractures and falls in elderly patients consistently recommend 4 types of movement beyond walking. These aren't optional. They're essential for maintaining independence. Pillar 1. Resistance training for bone density. Your bones are living tissue that constantly remodels itself. When you apply significant force to a bone, cells called osteoblasts build new bone tissue. When bones aren't stressed, cells called osteoclasts break down bone tissue. After 75, osteoclast activity increases, while osteoblast activity decreases. You're in a losing battle. The only way to slow or reverse this is to give your bones a reason to stay strong. Walking provides about 1.2 times your body weight of force on your bones. That's not enough. You need 2 to 4 times your body weight to trigger bone building. This means resistance training with weights or resistance bands. Research is crystal clear on this. Postmenopausal women who did resistance training 2 to 3 times per week for a year increased their spine bone density by 1 to 2%, while the control group who didn't strength train lost 1 to 2%. That's a 2 to 4% difference in 1 year. Over a decade, that's the difference between having strong bones and having bones that fracture from a minor fall. The best exercises for bone density target your hips, spine, and wrists because these are where the most devastating fractures occur. Hip fractures are the most dangerous. Spine fractures cause chronic pain and disability. Wrist fractures happen when you catch yourself falling. Here's what to do. You need exercises that load these areas with significant weight. Squats and lunges load the hips. Deadlifts and rows load the spine. Push-ups and chest presses load the wrists. You don't need to lift massive amounts of weight, but you need enough resistance that the exercise feels challenging by the last few repetitions. Start with bodyweight exercises if you're new to this. Sit to stand from a chair is a modified squat. Wall push-ups are easier than floor push-ups. Use a resistance band for rows. As these become easy, add weight gradually. Use dumbbells, kettlebells, or resistance bands with higher tension. The protocol: 2 to 3 times per week. Do 8 to 10 repetitions of each exercise for 2 to 3 sets. The weight should be heavy enough that you could only do 2 to 3 more repetitions after your last one. This is called training close to failure, and it's what triggers bone and muscle growth. Rest at least 1 day between sessions to allow recovery. Safety is paramount. If you have existing osteoporosis, avoid forward-bending exercises that put pressure on your spine. Consult with a physical therapist to design a safe program, but don't avoid resistance training entirely. Done properly, it's your best defense against fractures. Pillar 2. Balance training for fall prevention. Balance deteriorates after 75 for multiple reasons. Inner ear changes, reduced proprioception, your body's awareness of where it is in space, slower reaction times, weaker stabilizer muscles, and changes in vision. Walking on flat ground doesn't challenge any of these systems enough to maintain them. The research on balance training is remarkable. Older adults who did specific balance exercises reduced their fall risk by 23–40%. That's a massive reduction in the thing most likely to end your independence. Balance training works by challenging your stability systems in progressively harder ways. You're teaching your body to react quickly when you're off balance, strengthening the small stabilizer muscles that keep you upright, and improving the connection between your brain and your muscles. Here's what effective balance training looks like. Single leg stance. Stand on one leg for 30–60 seconds, holding onto a counter for support if needed. As this becomes easy, do it without holding on. Then do it with your eyes closed. Then stand on a pillow or cushion. Each progression makes your balance system work harder. Heel-to-toe walk. Walk in a straight line, placing your heel directly in front of your other foot's toes, like you're walking on a tightrope. This challenges your lateral stability. Tandem stance. Stand with one foot directly in front of the other, heel touching toe. Hold this position for 30 seconds. Switch feet. Standing weight shifts. Stand with feet hip-width apart and shift your weight slowly from side to side, lifting one foot slightly off the ground. Then shift forward and backward. Single leg reaches. Stand on one leg and reach the other leg forward, to the side and backward while maintaining balance. This is called the Y-balance test, and it's one of the best predictors of fall risk. Perturbation training. This is where someone gently pushes you off balance and you practice catching yourself. You can do this with a partner or therapist. This trains your reactive balance, which is critical for preventing falls. Sit to stand without hands. Practice standing up from a chair without using your hands. This requires leg strength and balance. If you can't do this reliably, you're at high fall risk. The protocol. Practice balance exercises daily. Unlike strength training, balance work can and should be done every day. Spend 10–15 minutes working through different balance challenges. Do this when you're alert and near something stable you can grab if needed. First thing in the morning or late at night when you're tired is not the time. Make balance training part of your routine. While brushing your teeth, stand on one leg. While waiting for coffee to brew, practice heel-to-toe walking. While watching TV during commercials, do single-leg reaches, integrated into your day. The goal is to make losing your balance and recovering a familiar experience. You're training your reflexes and your confidence. Many older adults fall because they panic when they feel unstable. If you practice being off balance regularly in a controlled way, you'll react more effectively when it happens unexpectedly. Pillar 3. Flexibility and mobility for functional movement. After 75, your joints stiffen, your muscles shorten, and your range of motion decreases. This happens from lack of movement through full ranges, from sitting too much, and from natural aging processes. The result is a shuffling gait, limited ability to reach overhead or bend down, and difficulty with basic activities like putting on shoes or getting in and out of a car. Limited flexibility directly increases fall risk. If you can't lift your foot high enough to clear obstacles, you trip more often. If your hips are stiff and you can't sidestep quickly, you can't recover from a loss of balance. If your spine is rigid, you can't rotate to look behind you without turning your whole body, increasing the risk of stumbling. Here's what you need to maintain. Hip flexibility. Your hips need to be able to flex, bring your knee toward your chest, extend, push your leg behind you, and rotate internally and externally. Stiff hips cause knee pain, back pain, and shuffling gait. Ankle mobility. Your ankle needs to dorsiflex, toes toward shin, to walk normally, climb stairs, and squat. Limited ankle mobility forces you to compensate with your knees and back, causing pain and instability. Thoracic spine rotation. You need to be able to rotate your upper back to look behind you, reach across your body, and maintain balance during twisting movements. Shoulder mobility. You need to be able to reach overhead, behind your back, and out to the sides. This is essential for dressing, reaching for objects, and catching yourself if you fall. Hamstring flexibility. Tight hamstrings limit your ability to bend forward, affect your gait, and contribute to back pain. The protocol. Daily stretching and mobility work. Ideally, twice per day for 10-15 minutes each session. The best times are after your muscles are warm, so after a walk or after a warm shower. Pillar 3. Flexibility and mobility for functional movement. After 75, your joints stiffen, your muscles shorten, and your range of motion decreases. This happens from lack of movement through full ranges, from sitting too much, and from natural aging processes. The result is a shuffling gait, limited ability to reach overhead or bend down, and difficulty with basic activities like putting on shoes or getting in and out of a car. Limited flexibility directly increases fall risk. If you can't lift your foot high enough to clear obstacles, you trip more often. If your hips are stiff and you can't sidestep quickly, you can't recover from a loss of balance. If your spine is rigid, you can't rotate to look behind you without turning your whole body, increasing the risk of stumbling. Here's what you need to maintain. Hip flexibility. Your hips need to be able to flex, bring your knee toward your chest, extend, push your leg behind you, and rotate internally and externally. Stiff hips cause knee pain, back pain, and shuffling gait. Ankle mobility. Your ankle needs to dorsiflex, toes toward shin, to walk normally, climb stairs, and squat. Limited ankle mobility forces you to compensate with your knees and back, causing pain and instability. Thoracic spine rotation. You need to be able to rotate your upper back, to look behind you, reach across your body, and maintain balance during twisting movements. Shoulder mobility. You need to be able to reach overhead, behind your back, and out to the sides. This is essential for dressing, reaching for objects, and catching yourself if you fall. Hamstring flexibility. Tight hamstrings limit your ability to bend forward, affect your gait, and contribute to back pain. The protocol. Daily stretching and mobility work. Ideally twice per day for 10-15 minutes each session. The best times are after your muscles are warm, so after a walk or after a warm shower. Key stretches and mobility exercises. Hip flexor stretch. Kneel on one knee with the other foot forward, like a proposal position. Gently push your hips forward until you feel a stretch in the front of your hip. Hold 30 to 60 seconds per side. Seated hip rotation. Sit in a chair. Cross one ankle over the opposite knee, gently press down on the crossed knee. You'll feel this in your hip and glute. Ankle circles. Sit and lift one foot off the ground. Make circles with your ankle in both directions. Then flex your foot, toes toward shin, and point your foot. Do 10 of each. Seated spinal rotation. Sit in a chair. Place your right hand on the outside of your left knee and gently rotate your torso to the left, looking over your left shoulder. Hold 30 seconds. Repeat on the other side. Doorway chest stretch. Stand in a doorway with your forearm on the doorframe. Gently step forward until you feel a stretch in your chest. This opens up rounded shoulders. Standing hamstring stretch. Place your heel on a low step with your legs straight. Keeping your back straight, hinge forward at your hips until you feel the stretch in the back of your leg. The key with stretching after 75 is to be gentle and consistent. Never bounce or force a stretch. Breathe deeply and relax into the stretch. Hold each stretch for at least 30 seconds because it takes that long for your muscles to relax and lengthen. Mobility work is different from stretching. Mobility involves moving through your full range of motion actively and repeatedly. Do arm circles, leg swings, spinal twists, and ankle pumps. This maintains the neurological pathways that control movement and keeps your joints lubricated. Pillar 4. Functional movement patterns. This is about practicing the specific movements you need for daily life. Many older adults become sedentary not because they lack general fitness, but because they struggle with specific movements. Getting up from the floor, climbing stairs, carrying groceries, reaching overhead, getting in and out of the car. If you never practice these movements, they become difficult or impossible. Then you avoid them, which makes them even harder. It's a vicious cycle that leads to dependence on others. The solution is to practice these functional movements regularly. Floor transfers. Practice getting down to the floor and back up again. This is one of the best predictors of longevity and independence. If you can't get up from the floor unassisted, you're at serious risk. Start with using a chair for assistance. Place your hands on a sturdy chair, lower yourself to kneeling, then to sitting, then lying down. Reverse the process to stand up. As you get stronger, reduce how much you rely on the chair. The goal is to do this without any hand support. Stair climbing. If you have stairs, use them daily. Practice stepping up and down, leading with different legs. Practice going sideways. If stairs are difficult, practice stepping onto and off a low step or sturdy box. This maintains the leg strength and balance needed for stairs. Carrying loads. Practice carrying objects while walking. Start with something light, like a gallon of water. Progress to heavier items. This maintains your ability to carry groceries and reinforces good posture while loaded. Overhead reaching. Regularly reach overhead with both arms. Place items on high shelves that you have to reach for. This maintains shoulder mobility and core strength. Ground reaches. Practice squatting down or hinging at your hips to pick objects up from the ground. This is essential for daily life, and it's one of the first movements people lose. Lateral movements. Practice sidestepping, shuffling sideways, and crossing one leg over the other while moving laterally. Most falls happen during lateral movements because we rarely practice them. Walking backward. Walk backward slowly while holding onto a counter or wall. This challenges your balance and coordination in unusual ways and builds confidence in unfamiliar movement patterns. The protocol. Spend 10 minutes per day practicing functional movements. Make it a game. Set up an obstacle course in your home. Practice getting up and down from different surfaces. Challenge yourself to do familiar tasks in unfamiliar ways. The goal is to maintain what researchers call movement reserves, the capacity to do more than your daily minimum. If your daily life requires you to operate at 90% of your maximum capacity, you have no reserve for unexpected challenges. But if your daily life only requires 50% of your capacity, you have a huge buffer that protects you from losing independence. The weekly schedule that works. Let me give you a specific weekly schedule that incorporates all 4 pillars. This is based on protocols that orthopedic surgeons and physical therapists recommend for their own patients over 75. Monday, Wednesday, Friday. 10 minutes. Balance training, single leg stance, heel-to-toe walk, weight shifts. 30 minutes. Resistance training, squats, rows, chest press, deadlifts. 10 minutes. Flexibility and mobility work, 20-30 minutes. Walk Tuesday, Thursday, Saturday. In 10 minutes. Balance training, 15 minutes. Functional movement practice, floor transfers, stair climbing, overhead reaches. 10 minutes. Flexibility and mobility work, 20-30 minutes. Walk Sunday, active rest, light walking, gentle stretching, recreational activities you enjoy, 10 minutes. Balance training, never skip this. Total time commitment, 60 to 70 minutes per day. This is what maintaining independence requires after 75. It's not optional if you want to stay in your own home and live without assistance. Notice that balance training happens every single day. This is intentional. Balance is the most critical factor in preventing falls, and it responds best to daily practice. The harsh reality of falls after 75. Let me be direct about why this matters so much. The statistics on falls in people over 75 are sobering. 1 in 3 adults over 75 falls each year. Half of those fall multiple times. Of those who fracture a hip, 40% will never walk independently again. 20-30% will die within 1 year. Not from the fracture, but from complications like pneumonia, blood clots, and the general decline that comes from immobility. Even minor falls that don't cause fractures create a fear of falling that leads to reduced activity, which leads to weaker muscles and worse balance, which leads to more falls. It's a death spiral. The most common fractures are hip, wrist, and vertebral compression fractures. Hip fractures often require surgery and extensive rehabilitation. Many people never fully recover. Wrist fractures compromise your ability to use your hands for daily tasks. Vertebral fractures cause chronic pain and progressive spinal deformity. But here's the critical point. Most of these fractures and their devastating consequences are preventable. The combination of stronger bones from resistance training, better balance from specific balance work, improved mobility from stretching, and practiced functional movements dramatically reduces fall risk and fracture risk. Studies show that older adults who do all 4 types of training reduce their fracture risk by 40 to 60% compared to those who only walk or remain sedentary. That's the difference between independence and dependence, between staying in your home and moving to assisted living, between life and premature death. Overcoming the barriers. I know what you're thinking. This sounds like a lot. You're worried about getting hurt, you don't know where to start, you've never lifted weights, you're afraid of looking foolish. Let me address these concerns directly. I'm too old to start strength training. You're not. Studies show that even people in their 90s can build muscle and bone with appropriate training. Your body retains the ability to adapt to stress throughout life. The older you are, the more important it becomes to start. I'll hurt myself lifting weights. You're far more likely to hurt yourself falling because you're weak than you are to hurt yourself strength training properly. Start light. Use a physical therapist or qualified trainer for the first few sessions. Focus on form over weight. Progress gradually. I don't have access to a gym. You don't need one. Bodyweight exercises, resistance bands, and a set of dumbbells are sufficient. You can do everything from home. I'm already doing yoga or Tai Chi. Isn't that enough? These are excellent activities that help with flexibility and balance, but they don't provide enough resistance to maintain bone density or muscle mass after 75. Add resistance training to your yoga or Tai Chi practice. I have arthritis and exercise hurts. Appropriate exercise actually reduces arthritis pain by strengthening the muscles that support your joints and maintaining joint mobility. The key is proper form and appropriate intensity. Work with a physical therapist to design a program that works for your specific situation. I don't have time. You have time. This is about prioritizing what matters. An hour a day to maintain your independence versus losing that independence and spending all day every day dependent on others. Which would you prefer? The biggest barrier is usually psychological. Many people over 75 have accepted decline as inevitable. They see their peers becoming frail and dependent and assume it's just what happens. But it's not inevitable. Much of the decline we associate with aging is actually from disuse. Your body is capable of far more than you think. Getting started safely. Here's how to start if you're currently sedentary or only walking. Week 1 to 2. Add balance training. Start with single leg stance while holding onto a counter. Practice heel to toe walking. Do this daily for 10 minutes. Week 3 to 4. Add flexibility work. Spend 10 minutes each morning and evening stretching the major muscle groups. Focus on hips, ankles, and shoulders. Week 5 to 6. Begin resistance training. Start with bodyweight exercises only. Chair sit to stands, wall push-ups, light resistance band rows. Do 2 sets of 8 to 10 repetitions of each exercise 3 times per week. Week 7 to 8. Add functional movement practice. Spend 10 minutes practicing floor transfers, stair climbing, and overhead reaches. Week 9 to 10. Gradually increase resistance in your strength training. Add light dumbbells or heavier resistance bands. Continue progressing balance challenges. Week 11 to 12. You're now doing the full protocol. Continue progressing the difficulty of each component as you get stronger. Throughout this progression, continue your daily walks. Don't stop walking. Add to it. Consider working with a physical therapist for at least the first month. They can assess your specific limitations, design a personalized program, teach you proper form, and ensure you're progressing safely. Many insurance plans cover physical therapy, especially if your doctor writes a prescription noting fall risk or mobility limitations. The bottom line, walking is wonderful, but after 75 it's not enough. Your bones need resistance training to stay strong. Your balance needs specific challenge to stay sharp. Your joints need mobility work to stay flexible. Your functional movements need practice to stay capable. The choice is stark. Invest 1 hour per day in these 4 types of training, or lose your independence. Most people spend more time than that watching television. This is about priorities. The good news is that it's never too late to start. Your body will respond at any age. You will get stronger. Your balance will improve. Your bones will become more resilient. Your risk of the devastating fall will decrease dramatically. You don't have to accept frailty and dependence as inevitable. You have agency. You have control. The tools are simple and accessible. The evidence is overwhelming. The only question is whether you'll use them. Start today, not tomorrow. Today. Do a single leg stance right now while holding your kitchen counter. Do 5 chair, sit to stands. Stretch your hips and ankles. That's your start. Build from there. Your future self, still independent and living in your own home at 85 or 90, will thank you for starting now.